Hi, Dr. Corey here, and I'm here with Thyroid Recovery Success Secret number 9. Today we're going to talk about anemias. Now, I mentioned that a number one cause of thyroid or hypothyroidism in the United States is autoimmune thyroid. But one question I get is, what if a patient isn't autoimmune? Now, since there are a small percentage of patients that are not autoimmune, what else could be the problem? Well, anemia could be the primary answer that you might be looking for. Anemia in and of itself is a deal breaker when it comes to nutritional support of any kind, including thyroid support, since anemia literally starves your body of oxygen. Oxygen is very important in the healing process, and your brain and nervous system needs two things to survive. It needs fuel and it needs activation. Fuel comes in the form of oxygen and glucose. So we're going to talk about glucose in the future, secret, but when you're depriving your body of oxygen, you're depriving your red blood cells of oxygen, which is a basic function and maintenance of regeneration and healing of the body, and the body simply cannot operate adequately if there is not enough oxygen present for the red blood cells to proliferate and to distribute throughout the body's tissues. So it's vital that the clinician or doctor you're seeing addresses the anemic patient. Now, anemia can be due to a variety of reasons and factors, including pernicious anemia, which is an autoimmune disease, or B12 anemia. For some forms of anemia don't seem to respond to iron supplementation because the red blood cells actually break down. They go through apoptosis, or they explode, and they can't handle that iron supplementation. So when this happens, supplementing won't increase the iron levels, and it can, in fact, make the problem much, much worse. Too much iron in the body is much more toxic than mercury. So lead, other heavy metals are also very, very toxic, but when we have too much iron, it can be just as toxic as those other heavy metals. Now, as I've said, and I'll continue to say, if the patient does not have an autoimmune condition, then you want to look at the 4 priorities. And the 4 priorities that we look at are: number 1, anemia; number 2, blood sugar or glucose levels; number 3 is your gut function; and number 4 is fatty acid metabolism. All of these need to be checked, and they're all vital for your recovery as a thyroid patient. So don't suffer for another minute, another day, another month, or even another year if this has been going on with you. Call our office at 714-730-5833. I look forward to helping you. I'm Dr. Michael Corey, and we'll be sending you another Success Secret in a few days.